It's 3 o'clock in the morning. You wake up with that familiar pressure telling you it's time to use the bathroom. The room is dark, the house is quiet, you are still half asleep, but you know the path well. So, you sit up, reach for your slippers, and start moving before your body has fully caught up with your mind. For many adults over 60, this feels like a normal part of life. Maybe it has been happening for years. Maybe it became more noticeable after a health change. Maybe it started around the same time a new medicine was added, but you never made the connection. Most people focus on the obvious question. Why am I waking up to urinate? That question can matter. Frequent nighttime urination is something to discuss with a healthcare professional, especially if it is new, worsening, or disrupting your sleep. But here's what many people miss. Sometimes the bigger risk is not only the bathroom trip. It is what happens after you get out of bed, especially if something you take is making you a little sleepier, drier, slower, dizzy, or less steady than you realize. This video is for education only. It is not medical advice, and it cannot tell you whether a medication is causing your symptoms. Do not stop, start, or change any medication without speaking with your doctor, pharmacist, or another qualified healthcare professional. After 60, medication side effects can be easy to mistake for aging. You feel more tired and call it age. Your mouth feels dry and you assume that is normal. Your digestion slows down and you blame getting older. You feel less steady in the hallway and decide your balance is simply not what it used to be. Sometimes those explanations may be true. Aging does change the body. But sometimes a symptom that looks like aging may be related to a prescription medicine, an over-the-counter product, a supplement, alcohol, the timing of a dose, or the combination of several things taken together. That does not mean your medicine is bad. Many medications are important. Some protect the heart. Some control blood pressure or blood sugar. Some reduce pain, prevent complications, or help people function better day to day. The point is not to be afraid of medication. The point is to pay attention when a change in your body lines up with a change in what you take. As we get older, the body may handle medicines differently than it did years before. The same dose that once felt ordinary may feel stronger later in life. A medicine that caused no obvious issue at 55 may feel different at 72. And when several medicines are taken together, the picture can become harder to sort out. That is why medication review becomes so important after 60. Not because every symptom is a side effect, but because side effects can hide in plain sight. Think about drowsiness. If you feel groggy in the morning, you may blame poor sleep. If you feel foggy during the day, you may blame age. If you feel unsteady at night, you may blame weakness. But if that grogginess began after a medication change, after adding an over-the-counter sleep aid, after taking an allergy medicine, or after combining several products, the timing is worth noticing. The timing often tells the story. When did the symptom begin? Did it start after a new prescription? Did it appear after the dose changed? Did it become worse after adding a supplement or non-prescription medicine? Does it happen at a certain time of day? Does it show up most clearly at night, when you are already sleepy and walking in the dark? These details can help your doctor or pharmacist understand what may be happening. One of the most common problems is that people do not always think of non-prescription products as medicine. They may remember to mention a blood pressure pill, but forget the sleep aid. They may mention a diabetes medicine, but forget the allergy tablet. They may list prescriptions, but leave out vitamins, herbal products, stomach medicines, pain relievers, cold medicine, or supplements. But your body does not separate them into neat categories. Prescription medicines, over-the-counter products, supplements, and alcohol can all matter. That is why a complete medication list is so useful. Not just the names of your prescriptions, but everything you take: vitamins, minerals, sleep aids, allergy medicines, pain relievers, Stomach medicines, herbal products, supplements, anything you take regularly, and anything you take occasionally. If you can, include the time of day you take them: morning, afternoon, evening, bedtime. Because sometimes the question is not just what you take. It is when you take it, what you take it with, and how you feel afterward. Now think about dry mouth. Many older adults assume dry mouth is just part of aging. But dry mouth can sometimes be linked with certain medications. It can affect comfort, sleep, speaking, eating, and dental health. It may also lead some people to drink more fluids at night, which can sometimes mean more nighttime bathroom trips. That does not prove a medicine is responsible. But if dry mouth is new, persistent, or began after something changed, it is worth asking about. Constipation is another symptom people often blame on age, diet, or reduced activity. Those can all play a role, but some medications may also contribute. If bowel habits change after starting, stopping, or changing a medicine, that pattern deserves attention. Urinary changes can be similar. Some people notice more urgency, others have more nighttime trips. Some may have difficulty urinating or notice a change in their usual pattern. These symptoms can have many possible causes, and some need medical evaluation. But medication effects or interactions may be part of the conversation. Then there is balance. For many adults over 60, this may be the most important part, because balance is closely tied to independence. A little drowsiness may not feel serious while you are sitting in a chair. But it can matter when you stand up, walk to the bathroom at night, step over a rug, climb stairs, get into the shower, or go outside on uneven ground. A little dizziness may pass quickly, but if it happens during the first few seconds after standing, it matters. A little confusion may be brushed off, but if it appears after a medication change, or becomes more noticeable at night, it deserves attention. This is where a quiet side effect can become a real life safety issue. It may not look dramatic. It may look like holding the wall, moving slower, feeling foggy after waking, having a dry mouth every night, being constipated more often than before, feeling unsteady in the hallway, needing extra time before you trust your balance. That does not mean you should panic, but it is worth paying attention to. One mistake many people make is waiting until symptoms become severe before saying anything. They do not want to bother the doctor. They say, "It's probably nothing," or "I'm just getting older." But a healthcare professional cannot review a pattern they never hear about. Another mistake is stopping a medication suddenly because of something read online or heard from a friend. That can be unsafe. Some medications need careful guidance if they are changed. Others may be protecting you from serious health problems. The safer step is not to stop on your own. The safer step is to ask for a review. A third mistake is assuming supplements are always safer because they seem natural. Supplements can still have effects. They can still interact with medications. They may not be appropriate for everyone, depending on health conditions, lab results, or other medicines. So the safer question is not, "Is this natural?" The safer question is, "Does my doctor or pharmacist know I'm taking this, and is it appropriate for me?" Alcohol also deserves an honest look. For some people, alcohol may add to sleepiness, balance problems, nighttime bathroom trips, or medication effects. The response is not the same for everyone, but if you are noticing drowsiness, dizziness, poor sleep, confusion, or nighttime unsteadiness, it is worth mentioning alcohol use during a medication review. The key is to notice the pattern. If you feel dizzy, when does it happen? If you feel sleepy, is it after a certain dose? If your mouth is dry, did it start recently? If constipation is new, what changed? If you feel less steady, is it worse at night, after a medicine, or after adding something new? If you have near falls, do they happen at a predictable time? These observations matter because they turn a vague feeling into useful information. Instead of saying, I just feel older. You can say, since this medicine changed, I felt more lightheaded when I stand up. Or, since I added this over-the-counter product, I've been more constipated. Or, I feel groggy during nighttime bathroom trips, and I'm worried about my balance. Those details can make the conversation much more productive. A practical step is to bring all medication information to an appointment. If possible, bring the bottles themselves, or take clear photos of the labels. Include prescriptions, over-the-counter medicines, vitamins, supplements, and anything you take only once in a while. Then ask direct, simple questions. Could any of these contribute to sleepiness, dizziness, dry mouth, constipation, urinary changes, or balance problems? Are any of these duplicates? Could any of these interact with each other? Does the timing make sense? Should anything be monitored more closely? What symptoms should prompt me to call sooner? These are not difficult questions. They are responsible questions. And pharmacists can be especially helpful here because they are trained to look closely at medication combinations, timing, interactions, and side effects. There are also warning signs that should not be brushed aside. Seek medical help promptly if you have fainting, severe dizziness, chest pain, shortness of breath, sudden weakness, sudden confusion, swelling of the face or throat, trouble breathing, a fall with injury, sudden trouble walking, or extreme drowsiness that makes it hard to stay awake. You should also contact a healthcare professional if you have repeated near falls, new or worsening confusion, trouble urinating, severe constipation, worsening balance, or symptoms that seem to begin after starting, changing, or combining medications. And if frequent nighttime urination, dizziness when standing, medication side effects, near falls, or new symptoms are becoming part of your life, do not treat them as something you simply have to tolerate. They are worth discussing, especially if they are new or getting worse. The deeper message is not that medication is something to fear. Medication can be essential. It can manage symptoms, reduce risks, and support quality of life. Many people take medicines because they truly need them. But safe medication use after 60 requires attention. Your body changes. Your health conditions may change. Your prescriptions may change. Your over-the-counter habits may change. And sometimes the side effect you are blaming on age may be a clue that your medication list deserves a closer look. That closer look should happen with a professional, not alone. So think back to that 3 o'clock bathroom trip, the dark room, the slippers. The first few steps, the slight grogginess, the brief dizziness, the need to hurry. If medication effects are part of that moment, they may be easy to miss because nothing feels dramatic. You are simply doing what you always do. But awareness can change the way you handle it. A complete medication list, a conversation with your pharmacist, a note about when symptoms happen, a doctor visit if symptoms are new or worsening, better lighting at night, slower transitions from bed to standing, a willingness to ask, could anything I take be contributing? This video is for education only and is not medical advice. Medication side effects, dizziness, confusion, constipation, dry mouth, urinary changes, and balance problems can have many possible causes. Do not stop, start, or change any medication without speaking with your doctor, pharmacist, or another qualified healthcare professional. The quiet medication side effect many seniors blame on aging may not announce itself loudly. It may appear as a dry mouth, a foggy morning, a slower step, a more difficult bathroom trip, or a feeling that your balance is not quite what it used to be. That does not mean you should be afraid of your medicine. It means your body may be giving you information worth bringing to the right professional. And at 60, that kind of awareness can help protect not only your health, but your confidence, your safety, and your independence.